Move on to standard 6. It's a little bit of a somewhat lighter topic, but I won't say it's an easy one. I think there's a little bit of depth to it that's important to take note of. It's a new standard, of course. So even though we haven't had these finalised, because of the delay in the commencement date, we anticipate that standard 6 is only going to be available for our category 6 providers, so residential care. If you work in home care, standard 6 and 7 at this stage aren't applicable, but I think everything at the moment has a little asterisk on it. But with standard 6 food and nutrition, as you can see on the left in orange, we've identified 3 moderate risk concepts, and they are the assessment of nutritional needs and preferences, menu planning, and creating an enjoyable food, drink, and dining experience. So the rationale for why those 3 are listed as moderate is because of their relationship to, I think there's 4 key national mandatory quality indicators: the consumer experience, activities of daily living, quality of life, and unplanned weight loss. Those 3 all relate to that quality indicator, which, if you think back to our classification of risk at the beginning, that's where we made this assessment from. As you can, probably put the pieces together and are well aware by now, when it comes to the high risk item of texture modified diet, that's because of the significant harm associated with dysphagia. So it's a safety issue, which is why I've put that as a high risk requirement. Tapping into that a little bit, I think we've touched on it already, but someone with dysphagia may experience coughing, gagging, choking when eating or drinking. And so, there's specific mention of dysphagia in the evidence mapping framework, where an auditor will be instructed to ask about how an older person that's at risk of choking is provided with support to eat and drink safely. So, that they will be asking staff, how do you support these people to eat and drink safely? We want to make sure that any staff that is, involved in that mealtime experience understands the risks associated with dysphagia and the role that a texture modified diet can play there. So here's our corresponding modules, most relevant to standard 6 food and nutrition. I've marked nutritious drinks and snacks as something that we don't have a module on at the moment, being very transparent and saying, we are working towards, filling any gaps in our library, based on our gap analysis. So there may not always be a direct resource, but often something like that can be met indirectly through another module. And again, a reminder here, I've put fluid in there because, as I've touched on already, understanding good fluid balance, safe hydration, and assessment of some of those risks associated with dehydration really can prevent harm. So what I mentioned just at the start about, not taking standard 6 too lightly, I know we can often look at some particular standard and think, oh, that's pretty good. Yeah, I think that, that's not too bad, that one. I just want to highlight that there is some critical importance involved in the training of standard 6. And I encourage us all to move, I guess, just beyond just food. When I look at standard 6 through the lens of, intensive care, clinical care, where's the risk, where's the harm, I think about it as a high risk, high impact requirements sit within standard 6. So we have significant health risks and complications that can come as a result of poor nutrition and poor hydration. So malnutrition has severe health complications. Dehydration leads to an increased risk of pressure injuries and UTI. A choking incident really is a preventable hospitalisation. We may need to send that person to hospital as a result of a choking incident, or at least administer, some pretty pretty full on first aid, but we would want to be ensuring that there's no aspiration pneumonia. That's often a transition of care to a more acute environment. And again, your dysphagia, you're looking at urgent first aid. So within Standard 6, really look at how we can use education wisely to safeguard against some of these more serious clinical risks that genuinely can come from nutrition and hydration concerns. How do we achieve that? As I said, there's a little bit more to it. I think, need to look at that role-specific training. It's not a spray and pray. It's really identifying, based on the risk and your target audience within your organization, who needs what. So your clinical staff, education there can focus on that, recognizing and responding to an emergency and escalating care, those more complex high-risk residents. Whereas your kitchen staff is around that food safety and handling, understanding, how we create those beautiful meals and menu planning. So, even though there is some, risk associated with our Standard 6, the way that we approach it can very much be, through different role-specific training. A quick look, because it's new, what auditors would look for. I've touched on it slightly. And it won't be a surprise, anyone that's done, many of these, webinars already will know that there is as much of a requirement for education as it is for good systems and processes. And that's really evident when we look at the audit requirements for Standard 6. There is a really heavy focus on developing and implementing systems and processes for food and nutrition. In terms of the evidence that auditors will look for, you've got a table, you've got documentation, evidence of engagement, and evidence of continuous improvement initiatives. So you can see what's highlighted. In terms of documentation, you might be asked to provide sample menus, charts. In terms of engagement, the Commission really wants to see active partnership with older people in terms of menu planning, and of course, integrating feedback into that process, and popping that evidence of feedback or a complaint directly into a plan for continuous improvement, will demonstrate that we're actively responding to that feedback and incorporating that into our service design.